Okay. Leslie, do you want to go ahead?
Sure. You don't want to say anything yet?
Okay. Well, I can just do a very brief, this is the Lane Lyceum, and we are taking on a series and that really focuses on food insecurity, consumption of food, the treatment of farm workers. It's a wide range of topics that we're looking at over the next month and a half, and so we're thrilled to have everyone here tonight. And what we will do with questions is, if you have a question, go ahead and type it into the chat, and Leslie or I will ask Jean the question at an appropriate time. So feel free to type in your questions as we go, rather than just wait till the end. And we also ask everyone to mute themselves so that we don't have the background noises. That would be great. Okay, great. And I'll have Leslie introduce Jean and all her wonderful work.
Okay, I'm happy to do that. I'm very happy to introduce Terranova to you tonight. It's a direct community where food is medicine is their motto, and that's what she'll be discussing tonight. Just for fun, food is medicine, and this is what I found. Food is medicine is a term originally coined by Hippocrates. We believe that eating wholesome food is the basis for good health. 2,500 years ago, Hippocrates said, "Leave your drugs in the chemist's pot if you can heal the patient with food." I thought that was interesting. So Jean is very involved in this philosophy. She's the site principal investigator for 2 large-scale NIH studies that examine the impact of community servings, scratch-made meals on the health outcomes for individuals with diabetes, HIV, and food insecurity. Jean's a graduate of Suffolk University Law School, and she's worn many hats as a social justice attorney and advocate. Jean also holds a professional chef's degree. I love that, Jean. And she serves on the advisory board of the Aspen Institute Food is Medicine Initiative and on the Policy Committee for National Food is Medicine Coalition. Jean is both a scholar and a trained chef, well-versed in the connections between wholesome food and good health. So welcome, Jean Terranova.
Thank you so much. It's great to be here. And I'm going to share my screen in a second, but I don't know if we beforehand can just do a show of hands or of raise hands in the Zoom on how many people here are already familiar with the work of community servings. No, okay. A couple of you, it looks like. Great. Great. So I'll give you sort of an introduction to our work. And as Leslie and Amy said, if you want to just put questions in the chat as we go along, that would be great. So with that, I will share my screen and start this from the beginning. Okay. Just can everybody see that?
Mm-hmm.
Okay, great. As Leslie said, I'm Jean Terranova. I'm Director of Food and Health Policy at Community Servings. We are based in Jamaica Plain, and we provide medically tailored meals and other services, as you'll hear, nutrition-based. Our mission is to actively engage the community to provide scratch-made, medically tailored meals to individuals and their families experiencing critical or chronic illness and nutrition insecurity. We commit in all our programs and business practices to prioritize racial and economic justice and health equity. We envision a world in which everyone has access to the nutritious food they need for health and well-being as a fundamental right. We do a lot at our Jamaica Plain-based food campus, and definitely encourage you to come and visit us and volunteer with us. We serve over 2,300 clients a year, and we've seen incredible demand during COVID. In fact, we are now serving 100% more clients today than we were serving in March of 2020. We'll serve this year 850,000 meals. We've served 11 million meals since we got started 31 years ago. We also lead a food service job training program for people with barriers to employment. And we host a robust volunteer program, seeing in our kitchen 50 to 75 volunteers every day. And before I get to our bold vision, we started this work over 30 years ago during a different pandemic. It was at the height of the AIDS pandemic, when essentially, if you were diagnosed with AIDS, it was a death sentence. And this was before antiretroactive, it's late at night, I'm losing my words, but before the medications that basically kept people alive with AIDS became available. And so community servings was really trying to give people the nutrition that they needed to stave off AIDS wasting syndrome so that they could live long enough for the medications to become available. And as people started living longer and AIDS no longer was a death sentence, we saw that our clients were developing comorbid conditions along with AIDS. They were experiencing conditions like diabetes, heart disease, renal illness, cancer, etc. And so our dietitians needed to find ways to address not only AIDS or HIV, but also these comorbid conditions. And over time, we thought, well, we're developing this incredible expertise in addressing, medical needs with nutrition. Why don't we start, expanding our mission and providing these services to people with other life-threatening illnesses? And what we discovered, excuse me, is that there was federal funding to provide these services to people with HIV and AIDS through a program called Ryan White, but there was nothing analogous to serve people with other illnesses. And so we started to raise money, excuse me, through philanthropy. And we also started advocating to say there should be legislation, there should be a way for reimbursement for providing nutrition to people with these other life-threatening illnesses. And just another sort of aside, what you might think of when you hear about community servings is a Meals on Wheels program. And what a lot of people don't know is those programs are funded through a statute called the Older Americans Act. And the services are limited to people who are over the age of 65 or who are disabled adults. And most of our clients don't fall within either of those categories. And so we really found a real gap in federal funding, in federal policy, in state funding as well. And so really started to try to build the base for advocacy. We are also part of a national coalition called the Food is Medicine Coalition. And we really have together a bold national vision in which we know that we're never going to achieve our healthcare goals of improving health outcomes, lowering healthcare costs, and creating equitable access to care without fully integrating the medically tailored meal model into healthcare payment and delivery systems. And the work of the Food is Medicine Coalition is to provide a complete evidence-based medical food and nutrition intervention to people who are critically and chronically ill, and in their communities. And so we really want to keep people out of nursing homes if we can, out of hospital settings, and enable people to live in their homes and in their communities. We also advance public policy that supports access to food and nutrition services for people who are critically and chronically ill. And we want to see this as a covered medical benefit within Medicaid and Medicare policy. We also promote research on the efficacy of food and nutrition services on health outcomes and costs of care. And finally, we share best practices in the provision of medical food and nutrition services, including medically tailored meals and nutrition counseling and education. And to the last point, before I think we got on this call, I was talking about a curriculum that we are delivering at Community Servings in partnership with members of the Food is Medicine Coalition and the Center for Health Law and Policy Innovation at Harvard Law School and the Nonprofit Finance Fund. And so we're really trying to train nutrition organizations across the country to deliver this service, because there really are not a lot of services like community servings across the country, about 13 currently. And so through this training program, it's called the Food is Medicine Accelerator program, we are trying to deliver this training to, we launched this in 2020, and so far we've been training 9 agencies across the country. So food is medicine. As we started this meeting today, we heard from Hippocrates, and we hear this term, this phrase, in many different contexts. And in the context of the Food is Medicine Coalition, both the national coalition, and we also co-lead a state-based coalition, we felt that it was really important to have definitions so that the medical community in particular understands what we're talking about when we say food is medicine, when we say medically tailored meals. And so it's really a spectrum of services. And in the next slide, you're going to see a pyramid that kind of emphasizes this. But what you see sort of on the left-hand side here is a produce prescription program. Many of you might be familiar with this type of program, where a physician might have a patient who is food insecure and has perhaps is at risk for developing diabetes. They might be pre-diabetic, and the physician might prescribe fruit or vegetable program so that the person will just increase their consumption of fruits and vegetables, and that can be reimbursed. Usually that's through a grant program. Another concept that you might be familiar with is medically tailored food boxes that can be picked up at a food pantry. And these are developed in consultation with registered dietitian nutritionists, and include not only fruits and vegetables, but also really the ingredients that someone might need in order to prepare a meal at home. So they're food insecure, and they are able to get themselves to a pantry, and they're able to shop and cook for themselves. And then at the final end of this is the medically tailored meal intervention, which is really more of a treatment intervention than a prevention model. And so with a medically tailored meal, this is home delivered to someone's home, developed by a registered dietitian nutritionist, and intended to basically help someone who really cannot stand at the stove, shop for themselves, cook for themselves. So this is someone who really doesn't have a lot of options in terms of receiving these other services on the left. And so here is the pyramid that I mentioned to you. And so sort of, it goes from the spectrum, goes from prevention to treatment. And, we are definitely not prioritizing one of these over the other. What we're saying, though, is that throughout the spectrum, there are different levels of need. So that, as I mentioned, a medically tailored meal program is very much targeted to people who are very ill and who cannot shop or cook for themselves. And so it's going to probably reach the fewest number of people in this spectrum, but it also has an evidence-based impact and is going to, save the healthcare system quite a lot of money, because the people who are receiving these services at the tip of this pyramid are those who are really costing the system the most money in hospitalizations, emergency room visits, etc. And then as you go down to the base of this pyramid, you get closer and closer to prevention levels of services. And so everything above the SNAP, WIC, etc., emergency food program category, we are advocating within the Food is Medicine Massachusetts Coalition to have these services reimbursed in some way through the healthcare system. And so we'll talk a little bit more about what Community Servings does, which is the medically tailored meal intervention. And so when we talk about this intervention, we're not just talking about the meal itself. We're talking about an entire array of services that complement the meal. And so in our case, we receive referrals from medical personnel or healthcare plans to our service. They will assess, usually looking at food or nutrition insecurity, as well as diet-related illness, and say, this person seems to us to qualify for a community servings program. So that referral will come into our office, and our registered dietitian nutritionists will make an assessment, determine, is this person eligible? And if they are eligible, and that eligibility is based on mobility as well as illness, then we will refer them to our client services team. And the meals, the dietitians will make sure that the meals are specifically tailored to the circumstances of the client. And our kitchen team, which is phenomenal, will make sure that the meals are cooked from scratch, and they'll work in tandem with the registered dietitians to make sure that the quality is really high, because as many of you might know, people who are sick really don't have a great appetite. And so the food really needs to be very appealing visually. It needs to taste great. It needs to smell great and look great. And so our chef's team makes sure that all of that happens. The meals are home delivered by our drivers in our refrigerated vans. And in our case, we don't use, we do have some volunteer drivers that help us on weekends, but for the most part, all of the meals are delivered by our delivery team. And then the clients, of course, enjoy the meals and get support from our client services staff and our nutrition staff. And then what we've seen through the evidence is that the clients will see improvement in health and reductions in medical spending in as few as 12 weeks. And throughout all of this, there's ongoing nutrition education and counseling. I see there's a question in the chat. Is that something that you all want me to answer now, or should we keep going?
Chat. We can keep going.
Okay, great.
Okay.
So this is a sort of a map of the diets that we offer. And we offer 15 different diets that our dietitians can customize in up to 3 different combinations, depending on the need. And so, for example, you might have a client who needs a renal diet and they have dentition issues, and so it needs to be soft. Or you might have a client who needs a diabetic diet that is mild, so low acid, and no fish. And some of these combinations are not just based on medical criteria. Some are really based on preference or cultural needs. So for example, we do offer a vegetarian diet. We offer these, limitations on proteins, no red meat, no fish, and other different options. Another sort of notion that people might have when they think about our meals is that they are intended to help people lose weight. And in some cases that is the case, but in some cases people need to gain weight. And so in that case, we offer a high calorie and high protein diet. So someone, for example, who has AIDS wasting syndrome, or someone who has Parkinson's and needs to gain weight might need a diet like that. So I'm going to go on and talk about the research that we've done. We, over the past 6 years, have partnered with a clinician from the University of North Carolina School of Medicine, as well as Mass General Hospital, to conduct studies that have been published in 4 journals, 4 different peer-reviewed articles published over the past 6 years. And they show that our meals are associated with 16% net reduction in monthly healthcare costs. And I say net because that is factoring in the cost of the meals. 72% fewer admissions into skilled nursing facilities, and 50 or 49% fewer inpatient hospitalizations. And so this has really started to open some eyes with respect to our discussions with healthcare payers as well as policy folks. But we still need to continue to do research because no matter, it seems that no matter how much research we do, there's always someone that says, yes, but what about? And so in order to address that, what abouts, we are now engaged in 2 different NIH-funded research studies that are examining the impact of our meals on clinical outcomes for people with diabetes and with HIV. That should say individuals with food insecurity and with diabetes, and with food insecurity, HIV, and diabetes. And so we're currently recruiting for these studies. There will be 400 participants in total. And we just got started with this. So certainly if anyone has any questions about it, I'd be happy to share that information. This was a highly competitive process in which we applied with our lead investigator. They are 5-year grants and over $6 million awarded to the full study team that includes the University of North Carolina School of Medicine, Mass General Hospital, and Community Servings. And so just a bit about our policy work. So it's, reflective of what I said in the beginning here. Anyone in the United States that needs medically tailored meal intervention should have access to it, regardless of where they live or their ability to pay. And anyone at risk for or in early stages of nutrition sensitive disease has access to tailored health promoting food through medically tailored food assistance. This is a shared vision from Food is Medicine Massachusetts, the Food is Medicine Coalition, as well as Community Servings. I'm not sure if anyone is familiar with this incredible program by the Massachusetts Medicaid program, but this launched in 2020, right before the pandemic. It's called the Flexible Services Program, and it allocated $149 million over a 3-year period of time to 17 Medicaid accountable care organizations. It is up for renewal now, and so we are happy to see that Mass Health is planning to continue this, or they have requested from the federal government to continue this. And so it allows for payment of certain health-related social supports in the areas of housing tenancy and nutrition for people who qualify. It's designed to meet the complex needs of certain members of this program by addressing health-related social needs. And then there is an investment in these social supports that shows that this can reduce, and this is a theory, and it's really proving to be true, the total cost of care for the members who participate. And just backing up on this, so there are 17 participating accountable care organizations. And so accountable care organizations are basically the healthcare providers within this system. Community Servings has contracts with 11 of these accountable care organizations, and we've served thousands of people by this point on this program, and it is proven to be successful. The early data has shown some real improvements in healthcare utilization and costs. And we are partnering with the University of Massachusetts Medical School, as well as the Friedman School of Nutrition, Science and Policy, to do a deeper evaluation of this program. And so, again, despite the evidence, we know that there are still serious funding gaps. And in particular, there is no coverage for meals in the traditional Medicare program, which covers 2/3 of Medicare beneficiaries. There is a small opt-in provision for certain beneficiaries to receive meals in Medicare Advantage, but that only covers 1/3 of Medicare beneficiaries. And so we've been advocating for a pilot program that would allow for Medicare to cover medically tailored meals. And Medicaid coverage for meals is state specific. As I mentioned, we are receiving some funding through Medicaid plans, but it is not by any means comprehensive. The Ryan White program, which I mentioned for people with AIDS, is the only comprehensive federal funding for meals targeting individuals.
Oh.
Jean, we weren't hearing you. We just lost your sound.
Our whole system's frozen, I think.
She may have to exit out and then come back in.
Yeah, she might.
Leslie, can you text her?
Sure.
Well, there are always a few surprises. We will see if we can get Jean back on. And in the meantime, if people have questions, go ahead and type them into the chat. Yeah, she's not here at all. Well, we've never had this happen. We've had other things.
No, we never have. Thank goodness,
Yeah. Well, I think I'll stop recording. It's,
Yeah. Let me just see. We'll have discussion. One of the questions was, how successful have discussions been with private insurers regarding coverage?
We haven't had a lot of discussions with private insurers because our goal is really to serve people who are food insecure. And so most of those individuals are going to be covered by Medicaid or Medicare, perhaps. But we have had some discussions. Actually, some private insurers have approached us recently and have expressed interest. In particular, for employment plans where it's in the sort of service sector. So people who are not making a lot of money, not high salaries. But yeah, those discussions we've just started embarking on. And it's really not something that we're going to go out and seek. It's more something that we would certainly respond to if people approach us.
Well, then a similar question was asked. Are all clients' medically tailored meals funded under a program like insurance or federal programs, or can individuals with medical needs sign up for a meal delivery?
So we've just started a new service called Servings Direct. And this allows people to pay for the service if they have the means and they want to.
Oh, that's great.
That's brand new. Mhm.
And so has that already started?
Mhm. It
Okay,
has.
great,
Yep.
great.
Any other questions before I get my screen back up?
No, not right now.
Okay, I'm pretty close to finished, so. All right, here we go. There we go. And I can't seem to get. It's not letting me share it in normal presentation mode. So I apologize for that, but we will just roll with it. So I mentioned the funding gaps. And so in order to sort of shore up those gaps, there has been legislation introduced called the Medically Tailored Home Delivered Meals Demonstration Pilot Act of 2021. One of our true champions of hunger, nutrition, and food as medicine is Congressman Jim McGovern of Worcester. He spearheaded this legislation. There are currently 40 co-sponsors of the bill that are bipartisan, which is incredible considering how difficult it is to get any bipartisan support for anything these days. But in this legislation, Medicare would cover the cost of medically tailored meals. This pilot would operate in 10 different states at 20 sites over a 3-year period of time. And Medicare beneficiaries with certain chronic conditions would receive at least 12 weeks of meals. And the chronic conditions are listed on the right, but congestive heart failure, diabetes, COPD, chronic kidney disease, end-stage renal disease, and others. And these are the illnesses that are really costing the healthcare system a lot. And so people would receive 2 medically tailored meals a day and one-on-one nutrition counseling or medical nutrition therapy sessions. So if you're interested in helping with advocacy for this, the bill certainly, Massachusetts has done really well. I think that we have most of our Massachusetts delegation signed on, but certainly Yeah, so I would say that it is not necessary at this moment to ask members of Congress to support this legislation at this point. We have our Massachusetts delegation signed on. If you're from other states, certainly let me know. But right now, the advocacy push for this is to be passed, we hope, during the spring. And then the other thing that we're advocating for is a White House conference on food, nutrition, hunger, and health. It is incredible to us that there has only been one such conference, and that was in 1969. But there are, yeah, there are some, and it was a very successful conference and led to some game-changing programs, including SNAP, that really would not have happened had it not been for you know, this kind of cross-sector group coming together and having this conversation at this conference. And then just generally, Leslie asked me to, you know, let you all know how to support community servings. We are always looking for volunteers in our kitchen. The volunteer program is open to individuals, corporate, and community groups. And we also offer volunteer experiences for some of our departments, including the meals and nutrition, finance, teaching kitchen, and events and development. Leslie was talking about our Pie in the Sky fundraiser, which is incredibly important as well, and happens before Thanksgiving. By buying a $30 pie from Community Servings Pie in the Sky event, you're able to provide ingredients worth of a week's worth of meals. And it looks like we are also hosting a Falmouth road race team this year. So this is all available on our website. You can also see how to make a donation and support or sponsor our events. We have one for Mother's Day called Meals for Moms, and we couldn't leave the dads out. So Dinners for Dads is coming up in June. And then I mentioned Pie in the Sky, which is in the fall. And with that, I will stop the sharing.
Great. Well, it's truly amazing how much you are doing and accomplishing. It really is. And the research numbers are so astounding to me that it just seems like a no-brainer that you know, that this isn't supported by insurers of all kinds, not just the Medicare and Medicaid.
Great, thank you.
Okay, anybody have questions?
Yeah, I just wanted to make a plug about the pies. So they're really delicious. The Pie in the Sky fundraiser, and it's a great time to get a you know, beautiful, delicious homemade pie at Thanksgiving. I've done it, so I recommend it. I don't see any more questions in the chat.
No, there is one. Where does
Okay.
your food come from?
We have, so we have a robust local foods program where we partner with farmers and fisheries, producers of eggs and dairy to help with our supply. Our chef is very committed to the local food system as a matter of policy. We also have partnerships with farms that through what we call an abundance program. And so the farm might be ready to plow produce under the ground because it hasn't sold and it's not perfect, but we are able to, and it's perfectly good and edible and safe to eat. And we have the volume and we have the volunteers so that we can convert, produce that is not beautiful and wouldn't sell in a market into, you know, sauces and soups and salsas, and a variety of other really tasty dishes. And so that is something that's just really important to us. But we have a number of distributors and partners in the local foods network.
Great.
See
Okay.
a hand raised by Ellen Fine.
Ellen, did you have your hand raised?
Yes, I've had a long day, so I can't put the thoughts into written word. I apologize. I was actually just really happy to hear that last part about you're basically doing food recovery. And I'm wondering for the, you know, for so many of these medical conditions, I believe that pesticides can be a factor. And so I'm wondering if you make a special effort on these medically tailored meals to have, you know, local and organic, because the pesticide factor, especially in the kidney and some of the other conditions, can be detrimental.
Yeah, I don't know what percentage of our foods are organic, of our ingredients are organic. I know that the partnerships with the distributors ensure that we have as high quality ingredients as we can and as our at our price point. I know that organic certainly, you know, has those very important qualities, but also does raise the price point for us. So I can't answer that question, but I do understand where you're coming from, certainly.
There are a
Thank you.
few more. Oh, sorry, Ellen.
Just saying thanks.
Oh, there are a few more questions about what the volunteers do.
Yep. So the volunteers are really the lifeblood of our kitchen, and they help with everything from chopping vegetables and peeling. There's peeling, there's chopping, there is packaging. And so there is scooping, you know, measured food into our meal trays and sealing and then labeling, and then packaging everything into the meal bags that then, you know, go into our coolers to be delivered. And so there's never a dull moment in our kitchen for volunteers in our kitchen.
Another one is, how far do you travel for delivery of meals to clients?
So we can serve the entire state of Massachusetts, whether that is through delivery or shipping. We will deliver anywhere within a 90-minute radius of our Jamaica Plain facility. We've recently started delivering into Rhode Island. And we have deliveries that go as far down as Cape Cod, as far west as Worcester, and I believe, I'm not sure where we hit the North Shore, but we are also on the North Shore. And so if we're not able to reach people by delivery, we do offer meals that are shipped.
And don't you have training programs too can you say something about that?
Yep. So we have workforce development training programs for people with barriers to employment. This is in the food service industry. And so we also have, in addition to the programs, which are 12 weeks, and help people work in commercial kitchens and get the experience of really formal culinary training, so that they can work, whether it is in a commercial industrial kitchen, so they can work in a restaurant kitchen. Some of our trainees who graduate from the program will end up in restaurants. Some will end up in school food service or nursing home settings, or in, you know, increasingly there are prepared foods opportunities at grocery stores. So we have a big partnership with Wegmans. So while the folks are learning the basic culinary skills, they are also getting that support in career counseling and in just basically, how do I search for a job? How do I write a resume? How do I conduct an interview? All of those skills are built into this program. We have a really high success rate, and just some of the stories of how people have, for some of our graduates, this is the first major, educational achievement that they've accomplished, and they will, bring in their families to the graduations, and it's a really moving program.
That's great.
Okay. Yeah, there's another question. Are all clients MTM funded under a program, insurance or federal programs, or can individuals with medical needs sign up for meal delivery?
Yes, so that through our Servings Direct program, they can, individuals can sign up, and this is a new program, but yes, they can.
Okay, great. Okay. I think that is it, but Jean, we thank you so much. You're doing such
Thank
important
you.
work, and
Thank you.
it's really wonderful to hear about it.
It was
And we
really
will.
great being here. Thank you.
Great, great. Okay.
Yeah,
Very
thank you very much, Jean. That was wonderful.
Okay, thank
I
you.
wonder, I'm sorry, could we get a written list of, like how to contact you about volunteer work or referring people to you? Or if Leslie could pass that along to us?
Well, I could
I-
pass that along, but you have a great website.
Yes, I just put the website in the
Okay,
chat.
terrific.
It's
Thank you.
servings.org, and it will lead you to volunteer and all of the different ways that you can support community servings right on the website.
Great.
Yeah, my daughter volunteers, and she looks forward to going in there every week. She goes every Tuesday. And yeah, she's made a lot of friends, and everybody works together, and it's a very supportive environment, and people seem to enjoy what they're doing there. She certainly does. So.
That's great. Thank you.
And I also, as I said, we have 3 more sessions connected to the food series. If you would like to be notified of those by email, if you would just put your email address in the chat, and I will make sure that you get on the list, and we'll send out the notice. So we're trying to reach as many people as we can. Okay, great. And have a great night, everybody. Thank you for coming.
Bye-bye.
Thank you.
Thank
Thanks
you,
so much,
Jean.
Jean.
Thank you. Hmm.